My name is Rod Taylor and I'm the Professor of Population Health at the University of Glasgow. You can see my university spire in the background, and I'm going to be moderating this meeting. Today I'm delighted to be joined by Professor Peter Johansson, Department of Health, Medicine and Care Sciences, Linkoping University, Sweden. Peter is the lead author of a paper called Trajectories and Associations Between Depression and Physical Activity in Patients with Cardiovascular Disease during participation in an Internet Cognitive Behavioural Therapy Programme. And this paper was published recently in August in the journal. To start off, Peter, can I ask you to give a brief overview of your paper, please?
Yeah. This is a secondary analysis of a randomized controlled trial where we evaluated the effects of an internet-based cognitive behavior program during 9 weeks in patients with this cardiovascular disease and depression. And the control group and was included in an online discussion forum. So during 9 weeks, one group have internet-based cognitive behavior therapy, and the other group had an online discussion forum. And after the 9 weeks, those in the online discussion forum was also able to use the internet cognitive behavior program. So the study is only randomized to the end of 9 weeks, then we break the randomization. And this study is a sub-analysis where we also we measured depression with a Montgomery depression scale during every week during the 9 weeks. We also added 2 questions about physical activity, which we also measured every week. And to keep that physical activity instrument brief, we used 2 brief questions, just not to boring the patients every week. So it's not the perfect physical activity instrument, but anyway, it was a secondary analysis. And then we found out that the depression program was successful. We have published data from and shown that after 9 weeks we had a moderate, strong effect of ICBT on depression in cardiovascular disease. And the main thing here is that also those who gave the therapy or was supervisors was cardiovascular nurses. So it's not psychologists, but this is cardiovascular nurses who had 1 day of internet education ICBT. So I think that is quite hopeful in that sense. What did we found? Yeah, we found that after 9 weeks, those in the ICBT group also had statistically significant higher levels of physical activity. Yeah, it was a measure of a subjective measure with drawbacks that can be seen, but there was we found that there was an increase of physical activity in a group who had ICBT. And then we was a little bit curious to look at how can we follow the changes in depression, because we measure depression every week, and how does that correspond to changes in physical activity? And we made a lot of analysis. This is just a fractional analysis in this paper, but and then we also found out how can we use this in a manuscript so the readers can understand what we have done. So there was a lot of choices to make. Anyway. Yeah, we found out that there was a correlation between changes in depression and changes in physical activity, and and that was interesting. And then maybe our main findings was that when we made a semi-structured equation model analysis, we found out that changes in depression has to come before there is changes in physical activity, because you also made a model where we put changes in physical activity before changes in the depression, and that model was not valid. So I think that, from my point of view, I think that is the most important finding from our paper, that okay, if we want to use physical activity as a treatment for depression, maybe patient with cardiovascular disease still needs to have help to decrease depression before we can expect physical activity to increase. And I think that is the major finding here.
Thank you, Peter. That was a great summary, and as you say, I think this objective of your study about not just asking what does internet cognitive behavioral therapy do to depression and physical activity, but then the second question where, correct me if I'm wrong, so your results say that actually if you don't improve your depression, it's unlikely that you're going to go on and improve your physical activity. So this is an important additional piece of information for us. Correct me if I'm wrong.
Yeah, I mean, I think you're right, and of course we have to be a little bit careful with our interpretation. But anyway, I think this is an important message to say that, okay, we cannot generalize these results to patients in cardiovascular disease in general, but we can say if patients have depression, we have to be careful just saying, okay, I'll go home and be physical active, because inherent in the aspect of being depressed, you're also inactive. So the patients needs to have help to increase their activity or what to say, break the vicious circle
Yes.
with their inactivity, because I think we need, because I also like physical activity as a help to make cardiovascular patients more active, but probably we will have to work with two tools, both ICBT and physical activity.
Yeah. Well, if I may, I might come back to that point, because I think there's an interesting question about how we take your results and then apply them to practice. But before we do that, I'm a statistician by background. I have to admit in public, and first of all, you don't often see these what we call mediation analyses. So in other words, what matters to get the result? Is it the depression predicts the physical activity, or the physical activity predicts the depression? Mediation allows us to look at that. And as you say, I think you undertook quite a lot of analyses to look, and you had to select out. So maybe just very simply for our listeners, what are there any particular challenges about applying this method, or is there anything you might advise on the choice of this analytic method you use to look at mediation?
I'm a very lucky one. If you look at one of my co-authors, Erland Svensson, he's nowadays retired, but he has been working with Jöreskog and Sörebom very close to develop this semi-structural equation model analysis, and we have been working really close together, me and him. So okay, so he's the really expert, and we often sit together and we work in discussion. And we used, but I like semi-structural equation model analysis because I think we can use more data and also gives more the bird perspective of the changes. So
yes. So you would recommend that where we have data sets like your randomized trial, we should use this sort of methodology more frequently?
Yeah, if we have a skilled statistician, I would say, because I think semi-structural equation model analysis is not that very easy. But I'm very lucky to have this very skilled person, and he is also a psychologist. So he's not only skilled statistician, but Erland is also very good because this is very psychologist. So we really can work with the questions both statistically as well as psychology. So yeah.
So point well made. You need a good research team, and in particular, when you're using these methods, actually having a formally trained statistician. That I think I would certainly support you, because I think the interpretation and the application of these methods are not always straightforward. So that's fine. So maybe a little bit of a health warning on these methods for our listeners.
Exactly, and I also think from a structural equation model analysis, it's very easy, because if you do other analysis, you have to have a theoretical model as a basis. Otherwise, you will go for a fishing tour. So it's very easy to get lost with SEM analysis if you don't have something to rely on. What are the assumptions for arrows to go in every direction? So you really need to be careful.
Yeah, and I've heard people talk about, you know, also having a theoretical framework when one
Yeah,
approaches these things.
yeah,
But anyway, let's get out of my favorite area of
yeah,
methods, maybe, and get back to the
yeah.
what might be the practical application here. So you might say in many ways the effects of internet cognitive behavioral therapy, a psychological intervention, improving physical activity through depression
Mm.
in a population with cardiovascular disease is not a really surprising one, Peter, because you've focused on an intervention targeting psychological well-being.
Mm.
So could you maybe think about how your findings, and you did a little bit of this, but how your findings might generalize to cardiovascular management more widely in the way in which we treat patients for cardiovascular
Yeah,
disease?
I think first of all, we have made an interview study recently with patients with cardiovascular disease who really, what they say that in Sweden, cardiovascular nurses generally do not talk about depression. They do not generally assess depression. We are really focused on medical issues. If you go for take that pill or you change your diet. So these patients, and I think depression very easily of psychological ill health often becomes a hidden or forgotten problem from for the medical encounters from the nurses or other healthcare professionals. We're really focused on the pills and diet and stop smoking, which of course is important. But so therefore, first of all, yeah, depression is or anxiety or whatever you're talking about are common and also disturbing problems of patients with cardiovascular disease. And then we just have to think about what to do about it. And generally, if we're talking about in the rehab, we don't have an overwhelming number of psychologists. And what we learned then we asked ourselves, could we use internet CBT because that will increase the access to psychological interventions in these groups. And during the years, we also have learned that these internet cognitive behavioral programs should be more contextual based so the patients can recognize themselves. So we cannot just use generic CBT programs because a lot of patients say, I don't recognize myself. I need to understand something. How is the correlation between CVD and depression, and how so we and the next fine thing with internet CBT is that, and there are other studies showing that as well, that the psychological part is in the text in the CBT programs. The supervisors more from, yeah, great, you have done a work job. Me encouraging the patient to work on. And then also what our patients said, it was great to have someone behind the screen who actually understood my CVD issues. And that says that maybe it should be a physiotherapist or nurse who's working in CVD. So from that point of view, these ICBT programs who could be more contextual based for CVD could be run by the rehab team.
Yes.
After a brief education in CBT, and of course there have to be a psychologist in the background.
Yes. That's very interesting, Peter, because I think from a UK perspective, if I may, and it's kind of ironic that I'm saying this on a day where we may be leaving Europe formally, but I'll continue with my comments nevertheless. And that is that we first of all don't have that many trained psychologists. So there's the first point. So we can't just say that this is an intervention delivered by highly trained PhD psychologists. And then the second thing is that they are very expensive, to be frank.
Yeah. Mm.
So this idea, as I understand it, where we train up rehabilitationists that in your case could be nurses,
Yeah.
not only improves the access, but also makes the intervention more cost effective.
Yeah. And we also know that from other studies and our own qualitative studies that these CVD patients with depression do not only have psychological issues, they also have medical issues which
Yes.
they need to discuss, and who is more fitted to take care of those two problems. Yeah,
Yes.
it could be physiotherapist or the medical health professionals working with CVD patients.
Yeah. 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 And I think that nicely takes me on to one of the common and contentious questions in the field of rehabilitation, which is, as you, I think, have intimated, that rehabilitation particularly has derived from a physical model or a medical model,
Yeah.
where the focus is often on exercise and physical activity management. But I think there's a recognition now that rehabilitation should be comprehensive. In other words, those providing the intervention, it shouldn't just be exercise and the drugs, but we also need to combine other interventions. And I think what your study particularly shows is the importance of managing their mental health well-being, such as their depression or their anxiety. Would that be a fair summary?
I think so, and then and anyway, I think we should not say we should not do exercise or physical care, but I think sometimes we need to combine these two. And
Yes.
and if we work with cognitive behavioral therapy, we can use CBT as a tool also to help the patient become more physical activity. Because what we learned from this study was that in the first week, the patient has to do some goal setting. What do I want to achieve, both as the overall goal and small goals. And then we found out most patients wanted to become active and wanted to increase their physical activity. So a lot of patients want to become physical active, but they also need help to get less depressed, and also have help to how because a lot of patients also set very diffuse goals. They say, I want to become more, after 9 weeks, I want to increase my physical activity. Okay, then we have to help the patient. Okay, what do you want to achieve the first week? How many times? What are smart goals?
Yes, yes, yes. So I think what you're saying is that one of the benefits of comprehensive rehabilitation is that the effect of the individual parts is greater than the sum of the individual parts alone. They may
Yeah,
interact and they may
yeah,
actually be multiplicative,
yeah.
and that's critical. Um, as you say, because patients don't come to us with one individual problem, they're also multiplicative problems, and we can do this with a more comprehensive approach in our rehabilitation.
Yeah,
Yes. Yeah.
because the first part of the CBT program is more psychoeducation, but the patients need, but we have the home tasks, and then they need to work. How does that refer to to my specific situation? And so a lot of our home tasks is that when do you have symptoms? How do you feel? But a lot of the, because I know from our cardiac rehab, we have a group of patients, we are forming them, and we maybe give them some paper to read about, but the patients seldomly need to refer it to themselves.
Yes. Yes.
Then, so that's one part of a program, also, that they will have to work with a home task. How does this fit to your specific situation?
Absolutely. It's a great discussion, Peter. So, Peter, I'm
Yeah,
going to finish with a last question to
yeah,
you, which is maybe to go back to the perhaps the more academic one, which is having done this research now, what would you see as being maybe one of some of the key research questions that remain perhaps in this area? And I know that's not always an easy question to
no,
ask. Sorry to answer. It's an easy question to ask, but if you
no.
had to identify one or two things, even in your own research, that you think will be important going forward here, what would be the sorts of things that you would be highlighting?
Um, uh, Actually, I have just received a lot of money from the Swedish Medical Institute of Health, and
Congratulations.
yeah, because we want to go further on now and look at, can we use a more personalized adapted ICBT programs where we can achieve both anxiety and depression, and can the patient choose their own programs And yeah, and so that is a more adapt, because sometimes when we're talking CBT, most people think that CBT is the same treatment for depression, anxiety, or whatever, and it is not. So therefore, we also feel that, okay, we know probably we can treat depression with this ICBT, but we also, a lot of patients have anxiety and stress, and we also need to approach that with ICBT. And so, and then of course we also want to measure physical activity again. But
Yeah.
we have chosen not to include actigraphy or something, but because that, if we would do some active measurement with devices, probably
Yes.
that also could be a booster, and we will really want to know what is the effect of ICBT.
Yeah.
So but we need a better subjective instrument to measure physical activity in that program. But
Okay.
that is what we're achieving, to do a more personalized, adaptive ICBT programs for patients with CVD.
Great. Well, Peter, it's been a tremendous pleasure talking to you this afternoon or this morning in UK.
Yeah.
Congratulations on this recent paper, and we wish you all the very best with your future research. Thank you for your time.
Thank you. Thank you.